here to be with Abby Schenk. She is a great local PT. And today we're going to talk about probably the most common, which is the low back. We know that a lot of it stems from poor form, but if you do have good form and you're still having chronic issues, we want to know how to take care of these. So Abby's going to kind of break it down for us, let us know maybe how we do get that pain and what we can do about it.
All right, yeah, thanks, Hank. So I see low back all the time. 80% of everyone will have low back pain at some time in their life. It's just kind of the way of the world.
That's a crazy statistic, right?
It really is. I mean, it's the highest disability, injury, chronic injury, so it's crazy. We can't get around the fact that our low back is the center of our body and it takes a lot of force. So we talked about posture, and if you're someone that sits at a desk all day long, you can't really change that. So one of the things we tend to start to do is slump back and round forward. So I'll tell people to work on the mobility of your tailbone through doing some tilts. So you tilt forward, you tilt back. This is where our body wants to be. This is where we want to be naturally. So if you can work on that in your desk, it will keep from this getting really stiff, that SI joint or sacroiliac joint that we've maybe heard of. That's actually our tailbone. So you want to make sure you're giving it some love if you've sat and typed for 6 hours or so. So you can do just that, and it's a good one, a good exercise to do before you get up to stand, right? So you got to move. Otherwise, it's been fixed for quite a while. You can also just do a nice hip opener while you're sitting at your desk. So you're typing away and you just come in and you give a little overpressure. You can push down and get really into that joint capsule, or you can push towards you and get into kind of that piriformis glute area that we all know gets tight from all of our exercises. I would hold that for like 30 seconds, 20, 30 seconds. Do it throughout your day, especially if you can't get up. And then you can also go through some back stretches. So you could work on just flexing forward, or I'll kind of go into a side bend where I'll stretch, hold a couple seconds, and go to the other side. So those are some good, just general, I'm sitting at my desk, I worked out this morning and now I'm really stiff, and now I'm feeling sore, and I want to make sure that that doesn't carry on into having back pain later today. All right, so some dynamic exercises you can do, or stretches that you can do to mobilize before pre-workout. Hip flexors get tight, which attaches to the bone on the front of your hip, which attaches to the back. So I will do I'll start with some angled stretching of the hip flexor. So I'll go forward and back till you feel kind of that stretch point. And then I'll also add some motions with my arms. So I'll get a side bend and a rotation. So now you're getting up into the psoas muscle, or kind of the hip flexor continuation, and a little bit into the back. So you'll go in, side bend. You can also just work on that tilt we talked about earlier. So just do a posterior tilt, and you'll feel a stretch right at the top of the hip bone where that hip flexor attaches. So you'll just go into that, and you don't even have to move. You already feel that nice stretch there. So I would work on that hip flexor mobility and also that lumbar mobility. You could work in just to a straight plane and open up that chest wall that's been kind of here all day long. And then from there, there's a muscle back in here called your quadratus that kind of gets really, really tight when we bend or we sit in our car or in our desk. So you could do a dynamic exercise where you have something to hang on to, or you could do it at a wall, and you're just dropping the back foot and coming overhead. You can come up. You could also do this at the wall just to keep stable. This is a really nice one. You get that full lengthening from all the way down and overhead. All right, so we've talked about the low back, but we cannot forget about our thoracic spine in the middle of our back. So our thoracic spine also moves when our low back or our lumbar spine moves. So I like to do this exercise at the wall. I'll put one arm kind of out here, so I'm getting a stretch in that front to open up that chest wall. I'll bring the arm overhead to lengthen the side, And then from there, I'm kind of fixing the thoracic and I'm moving my lumbar spine or my trunk. So I'll do some rotation. I might do some side bending. And I might do some forward and backwards movement. So you're just getting that motion, stretching the middle back while moving from the lower spine.